My name is Emmanuel Ame. I'm a professor of pediatric surgery and a chief consultant pediatric surgeon at the National Hospital in Abuja in Nigeria. I also serve as the co-chair for the ensues Implementation Committee for Nigeria and as the chair for the Global Initiative for Children's Surgery. This workshop is about improving access of children to surgical care in Africa. Presently, about 1.7 billion children worldwide lack access to safe and timely surgical care. Majority of them live in Africa and low and middle income countries. The surgical care for children, particularly in Africa and Nigeria, faces significant challenges, largely because the personnel required to take care of them is limited, the resources and the infrastructure required to take care of them is limited. Focusing specifically on neonates that require surgical care, majority of them present late because they are born mostly outside hospitals, and by the time they come late, they are very sick. And the current gaps that exist in their care is the fact that the specialized infrastructure required to take care of them, particularly neonatal intensive care services and facilities, are limited or non-existent. The kind of training that is required in terms of life support and resuscitative care, both at the primary referral hospitals and at the tertiary hospitals, is limited at the moment. And even affordability of care for these neonates is difficult because majority of the parents live on less than $2 a day. So the focus for this project is to find how we can address these challenges and gaps to improve outcome for neonates with surgical problems in Nigeria. And the focus is going to be on providing and improving neonatal intensive care facilities, improving training, both for resuscitation at the primary referral hospitals and for advanced life support for neonates at the tertiary hospitals. It will also include improving operating room access and facilities, as well as improving access for these neonates. This workshop is so important because for the very first time, we are not just looking at problems and challenges. We are coming together to develop initiatives and implement such initiatives that will improve the outcome of neonatal surgery in Nigeria and Africa. And I invite you to join us for us all to work together to begin to improve the access and outcome of the surgical care for children in Africa and low and middle income countries. Thank you.